Well, hello there, Radio Land and 1400 AM and 95.3 FM. This show is brought to you by the Windham Region Chamber of Commerce, Energize CT, and CT Paid Leave Program. I'm Ernie Eldridge, one of the hosts of the show here of ES Eldridge Auctioneers. And over on my left, way over the side here, is my co-host for this evening, Dan McClintock, owner of McClintock Roofing and president of the Chamber. We have a couple of guests tonight. We have Lindsay Rogers, Mariah Busineau, and you see I messed it up already, didn't I? And Flora Rivera. Dan, do we have maybe some sponsors here that we need to talk about?
We do. The Chamber would like to thank the sponsors of our show, Energize CT and Connecticut Paid Leave. I know you have been listening to me talk about the Energize CT program for months, and you probably are bombarded with different energy companies about different programs and services. The Chamber is not a company selling you something. We hear all the time that energy bills are high, so we decided to get involved and find out how we can help both businesses and residents. If you have not had an energy assessment done on your home or business within the last 6 years, you really need to do so. There are so many new incentives, it's crazy. Like, for example, if you are a family of two and your combined income is less than $62,460, or a family of four with a combined income of less than $91,854, then you are eligible for even more incentives like insulation, windows, and new heat pumps. And you won't even have to pay a fee for the assessment. If you are interested in learning more or setting up an assessment, you can contact the Chamber or you can go to energizect.com. The Chamber is also a Connecticut Paid Leave community educator, and we are here to assist employees with applications. So many employees do not know all the details about this program or how and when to apply. We are here to walk you through the process, help you plan for your leave, especially if you're having a baby, have a serious medical issue, or are taking care of someone else with a medical issue. And we can't promote this enough. If you work for yourself, you are a sole proprietor. What will happen if you get sick or injured? Do you have a short-term disability policy? The Connecticut Paid Leave Program is a way to help you when you are not able to work. You can enroll easily and for less than private policies. The cost is a small percentage of your income. If you would like assistance or have questions about the program, I just lost the page. Important one.
Eligibility
how to apply.
How to apply is info at wyndhamchamber.com, or a call or text us at 860-423-6389. I'd like to take a moment to thank our sponsors. We wouldn't have this show if it wasn't for the sponsors. A lot of things that happen with our programming. McClintock Roofing, Hartford Healthcare, Chelsea Groton Bank, Eastern Connecticut State University, Fine Federal Dispensary, Renee's Cleaning Service, Farmers Cow Cafe and Creamery, Pristine Power Washing, ES Eldridge Auctioneer, Greens Lawn Care and Landscaping, and Graduate Stores. Dan, we got some veteran news, do we?
I'll give it a go.
Okay.
A quick reminder for the veterans. Eastern Connecticut Veteran Center Coffee House meets every Wednesday from 9 to 11 at the Masonic Lodge. That's 375 Boston Post Road in North Windham. The Robert Slate Memorial Veterans Commissary is now at 1010 Main Street in the lower level every Tuesday from 1 to 5 p.m. and Wednesday from 11 to 2 p.m. Veterans will need to park in the lower parking lot behind the building and walk up to the Chamber building. We are currently looking for someone to lead our veterans program, like the programs like the Coffee House and the Commissary. It's a part-time position. You must have a driver's license, be able to speak in front of people, have some experience working with volunteers, be very organized, and not be afraid of fundraising. It's a very rewarding job with flexible hours. If you're interested, please send an email and resume to info@wyndhamchamber.com. Also, if you're starting a business or already in business and want to expand, you will need to grow your business base. And what is the best way to do that? Word of mouth. The Windham Region Chamber of Commerce has been helping businesses grow since 1887. We provide general and industry-specific opportunities to network with colleagues or potential customers. And we, as well as our members, are great resources for business services such as great prices and services on insurance, IT support, office supplies, retirement plans for your employees, HR support, and marketing assistance. In addition, the Chamber provides members with a marketing package that is valued way above membership dues, promoting members via newspaper, radio, newsletter, social media, direct referrals. For more information on how we can help you, call 860-423-6389 or send an email to info@wyndhamchamber.com. Do you know about our office hours? Each week we have an expert in the field available at our office at 1010 Main Street, Willimantic, to meet with you one-to-one, in private, to answer your questions or provide valuable information that you may need not only as a business, but also as a person. These office hours are open to the public, are free, and everyone is welcome, not just business owners. On the second and third Thursdays, this Thursday and next Thursday, we have an insurance expert available for our coffee and coverages from 10 to 2 p.m. She can answer questions about homeowners and auto insurance, business insurance, Medicare, and health insurance. If you need assistance applying for help, she can help. Also, our resident banker is at the Chamber next Tuesday, the second Tuesday of every month. That's July 14th from 9 to 3. Any questions about banking, credit scores, account types, or lending can be answered. And then on the third Wednesday, that's next Wednesday, July 15th, from noon to 4, we have a representative from the Small Business Development Center available to help you with any business questions, including market analysis for your competitors, business plans, funding opportunities, setting up finances, creating budgets. Appointments are not necessary. Stop by the Chamber at 1010 Main Street, Willimantic. You can find these days and times on the banner on our fence as well as our website at thewyndhamchamber.com.
Dan, you had a long list there of
Holy
things to
smokes.
talk about.
I
Holy
need to
smokes
breathe.
is right. So you take a little bit of a break, and I've got our first guest, Busineau, and she's from the Sexual Assault Crisis Unit. Welcome to the show.
Thank you.
And why don't you just tell us a little bit about the Sexual Assault Crisis Center of Eastern Connecticut, I believe is what you cover.
It
is that
is,
correct?
yeah.
Okay.
We call it SACIC.
What's your core
for short.
mission and geographic area that you cover?
Sure.
And-
So we are the local rape crisis center. We have been in existence since 1974. Years that we're serving the community. Our mission is to provide free and confidential services for victims and survivors of sexual violence. And we see men, children, and obviously women. A majority of our clients are women. We respond 24 hours a day, 365 days a year. We have a hotline that people can call if they feel they have a question, if something had just happened. If they need a little guidance. We are available to accompany people to the hospital if they want to have evidence collected. And there's a window of time in which that can be done. We can go in person, day or night, to do that. We can accompany them to the police department if they want to make a report to the police. And our services are free and totally confidential.
Wow. You do a lot then.
Yeah, and we actually have a very large territory. We cover all of Eastern Connecticut, are 41 towns.
Oh, wow. That is
So
a
Windham
big area.
County, New London County, and a little bit of Tallinn County.
Okay,
a
so
huge area.
is there different pieces of centers in different towns? Let's put it that way, if you understand.
So
what
our
I'm
main
asking.
office is right here in Willimantic,
Okay.
90 South Park.
Okay.
We've been there for a long time.
Yeah, you're over near me. I run the auction company.
Yeah,
Right there
I know.
you go.
I recognize the name.
Yep.
And we have a sub office in New London that we meet people by appointment.
Okay.
But sometimes, now since the pandemic, we've been meeting people via Zoom or whatever. But we can travel to if necessary, if people have issues with transportation and that sort of thing. Part of our program is that we run 2 child advocacy centers. These 2 places are child-friendly places where children go to give their statement. So that those interviews are videotaped, and that's what is used as a child statement, as opposed to having them go to the police department or talk to DCF or talk to different people. It's just like one stop, and those interviews are done in that setting. And so one of the child advocacy centers is in New London, and one is in Killingly.
So I'm sorry.
No, go for it, sir.
Do police meet you over there? Because
Yes.
it has to still be a police.
Yes, there's a
interview.
law enforcement and DCF.
Okay.
If it's a child case, obviously, a DCF would be involved. But yes,
So it makes for a better environment for the child.
for the child,
to
right?
be
Like
able
one-stop
to-
shopping. They don't have
Okay.
to talk to the social worker, the teacher, the principal, all these different people.
Or
So-
walk past the criminals that are locked up into
Exactly.
the radiator
So-
at the police station.
Right.
So, kind
Okay.
of, I guess, what misconceptions do people have about, sexual assault and things like that? Let's say someone gets assaulted, and, I guess some people say, "Oh, get over it," or something like that.
Right.
If you understand what I'm trying
Sure,
to
no.
get to, yeah.
Well, the biggest one, I guess, is that sexual assault happens with a stranger, right? So that's what people mostly think. But the majority of the cases happen with somebody that the victim knows. So over 85% of the assaults happen with someone that the victim knows. So that's one of the biggest ones. Another is that a victim is the right or wrong way to respond to an assault. Everybody is different, right? So some people are very affected, other people may not be as affected. The range of emotions is very big, so there's no right or wrong way. If somebody says they've been assaulted, they don't have to be crying or hysterical, whatever. So it's just different ways. But I guess that's the biggest one is that people are assaulted by a stranger.
I've heard that before. Let's put it that way. And now it isn't just, and you had mentioned this at the beginning. It isn't just women, even though
Right.
probably the majority are okay.
Correct.
But I mean, men and children. Is that correct?
Yeah, unfortunately, we do have about 25% of our cases are children, and we typically have about 800 cases per year ish. And unfortunately, that's a big number for child cases. And then, obviously, women are the biggest bulk of the assaults. But men, I've been with the agency for many, many years, and at the beginning, there was hardly any men that would come forward. Now it's not unusual for someone to call and reach for help. And most of the time, they're looking at something that happened in the past, and they never dealt with it because it was shameful to talk about it or it wasn't the norm. But now it's okay to talk about it, and so they're coming forward, or they see that their victimization has caused other things in their life, for instance, substance abuse or alcoholism or,
Sure,
that sort of thing.
I would think that it would lead to a lot of
Right.
different, trying to forget type of things.
Exactly.
So you use drugs or use alcohol or use something to try to, remedy what
Sure.
flashing through your head is such. So, but and I just lost my question. Dan, you got any that you
Sure.
want to shoot? Yeah,
So
go
if
ahead.
somebody was to call in,
Sure.
let's say they call in today, they call the hotline.
Right.
What happens at that point?
So we're there for, we never tell people what to do. So assuming that is an adult, right, we give them
Right.
their options. So, if it's something that happened within 120 hours, they can go to the hospital, they can have evidence collected, they can decide whether they want to report it to the police. They don't have to decide right then and there.
Okay.
They have 5 years now in which to do it. So that's sort of not that long.
Of course, if
that
there's going to
change.
be evidence collection,
Right, that
needs
has to
pretty
be
right
within
now.
that time.
Okay.
So we give them their options and to see what they want to do. We also offer counseling. So sometimes people may call past the time where evidence could be collected, or they're not really sure about reporting, and that's okay. They can come in for counseling, they can come in for services, and then maybe when they're feeling a little better, maybe they can make a better choice for
So
themselves.
they don't. I mean, they could come to you and just have a great conversation with
Sure.
you, and not necessarily have the police involved or something.
Correct.
And I suppose you could not direct them, but help them, decide whether they should go the other route or this route or something.
Right,
like
so
that.
we'll put all the options in front of them and have them decide, what might be the best choice for them. It's
Now,
could be
who do you
anything.
have on staff? Do you have doctors on staff? Do you have, crisis people on staff?
Yes,
type
so
of thing? Okay.
we are all certified rape crisis counselors.
Okay, fine.
Some of our staff may be social workers, clinical social workers. It depends, staff comes and goes. But we're all, certified to address the issue, and that in Connecticut we're protected by statute, so all our conversations are confidential.
Right.
And so people can feel free to share whatever. We're not going to repeat it. We cannot be subpoenaed. We cannot. So it's a
So you're counselors and social workers, therapists,
sure.
and you go to doctors.
Yes,
and
we
police
refer them,
and
yeah.
law enforcement. You go
Right.
to those as
Right.
you need them,
Correct.
but
Yeah.
in-house. Okay.
So let's say a person has gone through this crisis, let's put
Sure.
it that way, and it's been a number of years. I'm sure people still, like I said, in their heads are still, you're still reeling from it as such. Are you there for that type of service also, not just necessarily that it has to be what happened,
Something just recently.
yesterday or whatever? You said 5 years, but it sounds like that's a long period of time. Go ahead.
Yeah. So, as a matter of fact, a lot of my clients are older clients who were victimized as children, and they never really addressed it, and now they want to talk about it. And so, like I said, it maybe affected them in different ways, and they never dealt with it. So they do want to work through it. And so if, it could be a 60-year-old saying, when I was 8 years old, something happened to me, and I'm still thinking about it, or I still have issues, or maybe now they have grandchildren or children. Now they want to, look into it because they're having a difficult time, and that's fine.
Yeah,
And
okay.
like I said, we don't charge for our services. We get federal funding, state funding, donations. So all of it is free, so they don't have to worry about copays or things like that.
So do you take on volunteers? Let's put it that
Oh,
way.
absolutely.
And fundraising. Okay, so
Yeah.
what would a volunteer, if someone's out there and saying, "Geez, I'd love to help." Let's put it that way.
Sure.
That sounds like something I
We
could
love
help with.
volunteers. Depends on what you want to do. Some volunteers want to be trained to answer the hotline, the crisis line. So they have to go through this 40-hour training, and we talk about hospital protocol, police protocol. We give them all the information they're going to need to be able to answer the calls. And then they can sign up for shifts, different times, because we're open 24/7. So, that's really helpful to have those volunteers. And then we also do community education. We go to groups, we go to schools and talk about prevention, which is a great part of it. And so if they want to get involved with that, they can do that. We do tabling events. We have a table and information.
Okay.
So volunteers can help with that.
Now, my niece is the head of dispatch here in Willimantic.
Oh.
Kristen is, and so. Excuse me. Let's, not necessarily just that some people might call 911 if
Sure.
they have that, okay? And so do they direct it to you is what they do? Let's say someone walked up to the window and because they have walk-ups all
Sure.
the time. I mean, someone
Sure.
just, gets whatever and ends up coming into the police station and so they reference you. Is that what they do?
Yeah, so sometimes they'll have a special detective or a special
Okay.
person who handles the cases.
Yes.
And so they would, they will first assess, when did this happen? If it happened within that period of time, 120 hours, they may send them to the hospital so they can have the evidence collected. If it happened after, then they may want to just speak with them. But they will call our hotline and say that, we have a victim here. Could you come? And we're just there not to interfere, not to talk, but just to be as a support for that person.
Okay. So it's a live person that would
Oh, yes.
come to that person's aid, let's put it that
Yes.
way, even if they're at a police station or wherever they are
Right, day
at.
or
Okay.
night, yes.
Okay,
Right.
fine.
Yeah.
Okay.
Like I said, other things that they could do except for volunteering to support your
Well,
organization.
we always love donations, of
Okay,
course.
okay.
So any amount is very helpful. We had
and where would
several
would
cuts.
they find some place
So we have a website,
Okay.
and that is www.saccec.org.
Please
and
again.
it's SACCEC, SACCEC.org.
Okay, it's an acronym for
Sexual Assault Crisis
There you
Center
go.
of Eastern
Okay, there we
Connecticut.
go.
Right.
Okay, yeah.
And so we have a button there for donations. So that would be awesome.
Okay, okay. And the chamber has been asking folks for donations like clothing, personal hygiene items, etc. What's other things that maybe you see when people come into your? I would think that if someone comes into your facility to have some help, they really can't go home, or they really can't go here, or can't go there. I know that I worked with Sister Peter here when I was the mayor of the town, and worked with her over here. Is it St. Joseph's? Or yes, it is. Okay, and they have a place there that was for women that can't go home, with the kids and so on. So what are you looking for? How can you help in that department? How's that?
Right. So sometimes people do give us donations of clothing or like comfort kits, as we call them, which may have like a T-shirt, a shirt, pants, whatever. Because when someone goes through the evidence collection, they take their clothing if they were wearing them.
Thought of that.
So they would be, in the hospital. So they would have to leave the hospital with a hospital Johnny or something. So that's not as comfortable. So sometimes we get those donations, but we love like journals, art supplies, books for kids, anything that we can provide to the people that come in to see us.
But now your facility doesn't have any place for people to stay. Let's put it that way.
No, we don't have a shelter.
Okay, you're just not a shelter. Let's put it that way. So, do you work with local shelters in different areas? Let's put it that way.
Yep.
So,
right. Yep. So, United Services here has the domestic violence program. So we work with them, partner with them. In New London, we have Safe Futures, and then other regular other shelters that might be available if the client is not able to go home or they're fearful to go home.
Okay. All right. Now you work with the family. Let's put it that way. I'm sure that I guess you'd be instrumental in helping maybe their mother and father if it's a younger person who's had children and they're having trouble, and maybe work with the grandparents or the parents. Let's put it that way. I mean, that's got to be a very hard thing to do.
Yeah, we call those secondary victims, secondary survivors, because it affects them. It affects the whole family. So they're welcome to come in for services. They're come to talk to someone. So yeah, we're there for them too as well, because we know it's an issue.
So do you help the secondary survivors?
Sure.
So do you have people that come in, maybe they suffered sexual assault 10, 20 years ago. At this point, they're looking for therapy, counseling, and so they're
closure maybe.
Are you sometimes a better option?
Right, so we find, that people do sometimes work with therapists, and they've been in therapy for a long time, but sometimes the clinician may not be as familiar with certain parts of the trauma of sexual violence, or may not be as comfortable talking about that. So we often get referrals from clinicians to us to just address that particular issue.
Right, because this is your focus.
Right, and we work in tandem with them.
Okay.
Now, it probably... and I guess there's a word dicey come in, that, I mean, you're working with someone who's had a crisis, or who's a husband or someone else better, or the other half, let's put it that way. I mean, there's got to be some interaction there, I would think, that you have to deal with, or someone has to deal with, or not.
Typically, we don't see any type of offenders in our office or in our agency. So, usually if it's law enforcement's involved, they take care of that. But we typically would not see somebody who's offended.
Fine. So, again, why don't you give your website where you're at? Because we're down to about the last minute.
Sure. Okay. So our website is www.saccec.org, and that's SACCEC.org. And our hotline number is 860-456-2789.
We appreciate you coming on and talking about it. This is not an easy subject to really talk about, I don't believe. So thank you for
thank you for having us, especially because of that.
Right, exactly.
It's not the easiest for people to hear about it.
All right, we're going to go to break here, folks, and we'll see you in a little bit. Hello there, folks. We're back from break here on the Wyndham Chamber Show on Willie Radio, 1400 AM and 95.3 FM. And thanks for Matt being behind the dials, as he always is, making us sound great. I'd like to thank some of our sponsors that makes this show possible: McClintock Roofing, Hartford Healthcare, Chelsea Groton Bank, Greens Landscaping and Lawn Care, Eastern Connecticut State University, Fine Federal Dispensary, Renee's Cleaning Service, Farmers Cow Cafe, Creamery, Pristine Power Washing, and E.S. Eldridge, myself, auctioneer, and Graduate Stores. Dan, you've got our second guest right here in our studio. Go ahead, Dan.
I will. Thank you. I have Flora Rivera here from the Community Health Navigator with Hartford Healthcare. So, cervical and breast cancer prevention program. What exactly is that? Why? Give us the general overall of that, and then we'll go into questions and such.
Sure. So thank you for having me. Thank you for the time. So the CBCC, as it is well known, is a program that helps women with cancer prevention by covering women that have no insurance or underinsured. Mm-hmm. We pay for their visit to the gynecologist. We cover their PAP, HPV testing, mammograms, even diagnostics. That's what the CBCC program is.
Now that I would think that you cover a large range of years or ages. Let's put it that way. Not just older people. Let's put it that way. I would think that most of it would be younger people. Am I correct?
You are correct. So this program starts from age 21 up to age 64.
Okay.
That is the range of females that we cover, and based on their age is the category of testing that we will do. For instance, mammograms are for women ages 40 and over.
Okay.
Right? So depending on what their needs are and what their age category is where they will fall with the testing.
Yeah, after 65, they'll have federal insurance, or they'll have insurance of some type.
Most likely.
Most time they do when they retire or whatever after you turn 65. So this is important for the earlier stages, because I'm sure there's a lot of young people out there, young ladies, who just can't afford insurance. I mean, insurance is a very expensive commodity unless you have somebody that's, you work for that's paying for it. So.
Well, and unfortunately, we have a lot of members in our communities, and I cover the East region from Norwich all the way to Putnam. Mm-hmm. And what we have found is the need is large because people are losing insurance nowadays. Unfortunately, because of the cuts that are taking place, they may have had insurance last year, and now this year they find themselves without affordability. They can't. And then we have people in the community that for other reasons don't have insurance. Okay. So this is where these programs that are prevention, our program is to prevent cancer. If you catch it on time and early, is a more successful and a powerful chance for us to treat it. So cancer prevention is really the key.
Right. So when you're saying prevention, you're talking catching it in the earliest stages before it turns to something serious. So who qualifies for this program?
So for these programs, for the CBCC program, is for women's ages 21 up to 64. There are some exceptions, of course, after that age, that's individually based. But the grant is going to cover 21 to 64. These ladies cannot have insurance. If they are underinsured, meaning the insurance doesn't cover prevention, then we will take them in even if they have insurance. All right?
Okay, so they can have it, but if their insurance says, no thanks, we're not doing that.
That is correct. There are some insurances that don't cover preventative. We will use the grant for that.
Okay.
Now, do you work with insurance companies? Let's say a person does have some insurance and you're saying, look, we need this done to do this so that we prevent it and so on. I'm sure that you work with insurance companies, do you?
Good question. So there's always exceptions to everything, right? Yes, we do take insured patients for diagnostic. If they have gone to their doctors and now they found something positive, but the insurance doesn't cover, then we can bring those patients for diagnostic testing and move them forward from there.
All right.
So you're saying some of the insurance companies might pay for the tests, but maybe not pay for some stuff moving forward.
For further treatment, for further diagnosis. Right.
Okay.
So if they have to do an ultrasound because they did a mammogram and they found BI-RADS, right? And now they are required to do diagnostic testing, which is an ultrasound. Some insurances may not cover that. Okay. So the grant can come in and say, we'll help this patient. And we can cover the diagnostic testing.
Is there any group of individuals that are more receptive? What's the correct word? I've got it wrong here. That maybe has more troublesome with this area than other.
More susceptible?
Whether it be, right, exactly.
Barriers?
Right. Yeah, whether it be Spanish or whether it be, Caucasian.
Accessing the programs?
No. Do you have more of a certain group of individuals that have problems more than other individuals? Maybe you can't answer that question. I'm not sure.
So when it comes to cancer, Latinos and blacks are the higher numbers.
Okay, fine. That's
that is
what
the
I guess
question.
I was trying to get to. I could not.
That's
find
what
the
I
correct
figured.
terms. Okay, great.
So the percentage is already showing that Latinos and black communities are the ones that are most exposed to cancer, right? Years ago, we were looking at ages 40 and over.
Yes.
Unfortunately, for whatever reason, now we're seeing younger people getting affected with cancer. And it's not just women, okay? That's throughout.
I hadn't even thought of that. Okay. It's not gender orientated necessarily for some, let's put it that way. So.
It depends on the cancer, right?
Yeah.
So
Especially
in
like
our
breast cancer or something like that, men can get breast cancer along with women getting, yes.
Yes, men can get breast
cancer.
cancer.
Does that fall within your programs then?
So right now, this program is mainly for women. Right? We would have, like I have in some cases, a female in my program concerned about her husband. Right now, all we offer as prevention is the colorectal cancer prevention program. That does include males, 45 to 75.
Okay.
Women as well, 45 to 75.
Okay.
So in that sense, I can help them with that.
Okay.
We send them if it gets home. They can do it in the privacy of their home.
Okay.
The test gets put in an envelope. Privately, it's prepaid. It gets sent to the Quest lab.
Okay.
And then by mail, they receive the results. If it's negative, if it's a positive, we also pay for the colonoscopy.
Okay.
Yes.
Okay. All right.
Yes.
So now you have a Wise Woman program.
Oh, yes.
What? Oh, yes. All right.
I love it. That's my part of the program.
I'm going to say.
All right. Tell us about that.
So the Wise Woman program is the part of the program that I actually work. It comes together with the CBCC program. A woman has to get enrolled in the CBCC program to get scheduled to see the gynecologist, right? Who's going to start all the testing. They're going to do the cervical exam, the breast exam. They're going to do blood work if the woman is 35 and over.
Okay.
That's how they become part of the Wise Woman program. When that happens, at the appointment with the gynecologist, they're going to get their weight, their waist circumference, 2 blood pressure readings. They're going to do lipids and glucose. And all those results will be sent to me. In the East region. This is throughout Connecticut, so there's other navigators available. So if the listeners are concerned because they have family members or friends somewhere outside of Willimantic, let us know. We can connect you with the navigator that works your region. So I work the East region, but we are throughout Connecticut. Once those results come back, then my function is to reach out to these women that are 35 and over with these results, right? Because now we take care of their cardiovascular health also. It's very important that we address healthy lifestyles, eating healthy, doing exercise. And so these women are going to get their results if they are abnormal. They stay in the program for up to 90 days with coaching. We just don't let them be. So they will receive a call every 2 weeks. We talk about nutrition, how are you cooking, what type of meals are you preparing, what's your portion size, and we start talking about how to make changes to better your lifestyle. And we also start talking about exercise and why it's important. Recommendation is 30 minutes per day, 5 times per week minimum, right? And that can be broken down however they want. And then during this process, they also going to get support. How? Well, if they want to work out and they don't have equipment, we can supply them with, for instance, yoga mat, so they can do abdominals at home. Pilates at home if they want. I always coach them to download an application so they can see samples of exercises if they
Right.
don't know how. When I deliver the tools to their home, I take the time to sit with them and show them how to use it. It's not just delivering. Let's
Right.
see how you can use it, right? Give them ideas.
Sure.
We also can provide them with Planet Fitness for up to 90 days.
Okay.
The grant will cover that. Weight Watchers is also available for up to 90 days. At the end of the 90 days, I will meet in person with the participant, and I will also do the lipid, glucose testing, the weight, everything all over
Do that
again.
again. All right.
And we'll compare where you were 90 days ago to where you are now. And let me share a story. I just saw a patient 2 days ago, and I'm sorry, Thursday. I apologize.
That's all
Thursday,
right.
and she had lost 7 pounds, had improved all her numbers, cholesterol, blood pressure, and sugars, and she was so happy, so grateful that she had this program available to her. We also have patients that have been positive to the mammogram, right, by rats, and we navigate them. If they don't have insurance, we navigate them so that these services for treatment, because we don't cover that,
Right.
can be covered through other grants or financial assistance through the hospitals. They always get navigated. We don't leave them behind.
So you're all right. So your title is you're the navigator,
Correct.
and if you help these programs like you discussed, but then beyond that, you can refer them
They get referred. Yes.
to other places so they can continue with their improvement and their
Correct.
health care.
Correct. Yes.
Okay.
Yes.
Now we're talking about different parts of the body, but how does the heart and that type of thing interject with, cancer or interject with whatever? I mean, I would think of it as two different subjects, so it's that way, but it isn't two different subjects. Am I correct?
It is two different subjects, but it affects each other, right? Because if the patient doesn't feel well, never mind the cancer portion of it, but if they're already dealing with high-risk conditions like high blood pressure, that's going to be detrimental to their improvement when it comes to the cancer. So they become high risk because now they have high blood pressure to deal with, which is going to exacerbate what they're dealing with the cancer.
Okay.
Chemotherapy afterwards, radiation afterwards. So we try to help them bring everything to normal levels before any of this takes place.
So what are some of the biggest barriers that you run into that women run into trying to get?
It's a variation of a lot of things, right? One of the biggest things they're facing nowadays, because of what's happening around us, is fear. Fear of coming to an appointment and something can happen.
So just fear of finding out?
Right.
Fear of finding out, fear of who can be at the appointment, who can be out of the building when they come out of the appointment. I just don't want to go into details.
I see what you're saying.
But what's
Yes.
happening in the government, right? Some of
Okay.
these people that we're dealing with don't have insurance for a reason,
Right.
right?
Okay.
It depends where
All
they
right.
come from.
Yes.
And so, without going into details, a lot of the patients that we deal with that don't have insurance have fear of not knowing the system, of not understanding the medical system,
Right.
the language, transportation, obviously not having the insurance, and fear of what's going to happen if I get found out that I am positive to cancer. Who's going to pay? How am I going to do this? Right? So they have a lot of barriers. The good thing with the program is that we don't leave them alone. So we always find ways to navigate them to resources.
Okay.
And that's where we come in. We have the resources they need to move on to the next step.
Okay.
And do it confidently and safely and without fear that something else is going to happen.
All right. So there's a lot of people. I mean, I know there's more enlightenment, more focus on these kinds of things these
Yes.
days.
Yes.
More knowledge out there, which does not mean everybody has the knowledge, though.
Correct.
So what would you say to somebody who is, putting off these tests?
Well, I'm glad that you guys are giving us this opportunity because I'm fairly new in the area, and this is what I'm trying to do. I'm trying to get the word out there because prevention is the key. If you're putting off the test, that's not going to help, because if you're waiting to get symptoms to then go, it may be too late.
That way. Yeah,
Right?
I never thought of it that way.
Well, a
You
lot
could be
of-
feeling great, everything's okay, but you don't know
I don't
what's
need to
cooking
go.
inside. Right, you don't know what's cooking
Right.
inside.
And a lot of people do it not only with prevention, cancer prevention, with everything. You have a lot of males, for instance, no offense,
Right.
but males try not to go to the doctor because they don't want to know.
We
You
don't
have to tell
need
me.
to. do it.
Right. So you,
It's not the same.
so you guys wait for the symptoms. When you get sick, now I have to go.
Right.
Well, with cancer, it's really about prevention because keep in mind, if we can diagnose you at an early stage, you have a high chance of having that taken care of
Right.
and be successful in the treatment.
Okay.
The longer you postpone it, the higher it becomes at a stage where it may not be treatable, or the treatment may be more difficult.
Right.
Right? We still can, but it may be more difficult. So the key is prevention.
Okay.
Don't
so,
postpone it.
Right. And all right. So you keep saying prevention, and for some reason I keep hearing early diagnosis, and because the earliest the better.
Correct.
But so, do you also have programs like where you are like talking to people about lifestyle stuff?
That's the Wise Woman program.
That's the Wise Woman program.
So the
That's
Wise-
right. So that's all right. And when you were talking about that, I was hearing, okay, after somebody's in, but the Wise Woman program is for even before
The Wise Woman
diagnosis or
program,
before?
well, you don't have to be diagnosed with a positive, right? So we
Right.
are preventing. So what are you doing? Your annual visit. This is about doing your annual visit with the gynecologist.
Yes. Okay.
Right? Just like we're supposed to go to our regular provider
Mm-hmm.
once a year. What are we doing? Preventing. Because
Right.
they can monitor your blood pressure, they can do your lipids, your glucose, they can check your cholesterol level. So it's about prevention. When we go to
Right.
our providers, right, what are we doing?
Yes.
The doctor's going to say, well, I see you gain a couple of pounds. Let's talk about that. We need to start changing your eating habits so you can control your weight.
Right.
Why are they saying that?
Your
Because
blood
your
pressure's
weight,
maybe going slightly up.
correct.
Let's catch it
Your
now.
weight is
Yeah.
a detrimental factor to increasing blood pressure. So that's why your annual checkup with your provider is key.
So when you're saying lipids and glucose levels, these are indicators
They are.
something might be going over the horizon.
Correct.
All right. Now I'm hearing prevention.
Prevention.
Yes.
now,
Putting
Now
it
I hear
together.
it. I'm getting it all.
Good.
So are you connected with physicians around the areas that will call you? A person will say, well, we found this out or whatever, and, I don't know what to do. And they will say, this is where you should go. Is that correct?
Yes. So we
How
have
do
been.
they find you?
Well, this is how they found us. First of all, I'm doing outreach, right? This is what I'm doing right now.
Sure.
I'm doing outreach. I'm constantly in the community. I already went to the senior center. I go to the soup kitchen, not only here, but throughout, right? From
Yeah,
Norwich all the
other
way
ones.
to Putnam.
Yeah.
I already had done presentations at the hospital, and we have connected with providers in the communities so that we can refer these patients to them. Here in Willimantic, we actually work at the women's clinic here at Wyndham.
Okay.
And that's where we schedule our appointments,
Okay.
right? They see
Okay.
our gynecologist there. They also go to Wyndham Hospital Radiology for their mammograms and diagnostic testing. We also have the benefit of working with Planned Parenthood here in Willimantic, also in Norwich. And in Bacchus Hospital, we do the mammograms for ladies in that area.
So now do you pay for, let's say, the mammogram? This program does that type of thing? Is what
That's what the grant does.
Okay, fine.
Yes.
Okay, fine. Okay.
So the grant is going to cover the visit to the gynecologist, all the tests that they do that we request,
Okay.
like blood pressure, the weight, lipids and glucose, weighing the patient, HPV testing, the pap, and then they do the requisition to actually do the mammogram at the radiology department.
Okay.
We cover all that.
Okay.
Okay.
Yes.
So if there was one message that you want to get out to all the listeners today, what would it be that we need to remember?
Having had family members who have gone through cancer, different kinds of cancer, not necessarily, breast cancer or cervical cancer. Prevention is the key. If you take matters into your own hands right now, listeners, and you reach out to us, and I can give them my number.
Great, that's what we need.
The number to call is 860-929-9890. You'll reach me, and I'll be more than happy to navigate you and see if you qualify for the program. If you prevent by scheduling appointments, not just my program, any appointment that you should be doing on an annual basis, please do. This is the way you're going to prevent yourself from finding out when it's too late that something is wrong.
Right.
Don't wait for the symptoms to then decide, I have to go see a provider, right? This program is available to women ages 21 to 64. We pay for almost everything, and we will guide you through the whole path. We're here to help you. We are here. We're your team. Just give us a call at 860-929-9890, and I'll be happy to help you.
Nice.
Flora, it was great having you on.
you.
And what a wonderful show it really was.
Thank you so much for this opportunity and for the listeners to be in there. Thank
Very
you.
good.
Thank you,
It was a
Flora.
pleasure.
The pleasure is ours, that's for sure.
Thank you.
We've got a couple of things here, do we, Dan? I think we do. How's
We
that?
do. We've got some chamber events coming up.
Good.
Let me see. On July 9th, that's this week, July 9th, is Coffee and Coverages. That's 10 a.m. to 2 p.m. That's over at the chamber
Sure,
office.
talk about insurance and stuff.
Exactly. That's this coming Thursday. The following Tuesday, Resident Banker is 9 a.m. to 3 p.m. over at the chamber office. We're going to have a member appreciation
that sounds pretty darn
picnic.
good.
Now, that's for the chamber members. So all you chamber members out there, want you to come to the Farmer's Cow Cafe. That's 12:30 to 2 o'clock on July 14th. That's also a week from today,
Got it.
Tuesday. All right. And you've got some stuff happening at the Gilson?
Yeah, we do. We'll do it real quick here. We've got the 250th anniversary. Of course, I had a float in the parade, or the Gilson House did, but we're going to be talking about Gwen Bruno, the president of the Wyndham Preservation, which is the Inn. She's going to talk a little bit about that and the history, and that's at 6 p.m. at the Gilson House. And then, of course, Tavern Night this month at the Gilson House, which is Wednesday, July 22nd. Guest speaker is special Betty Ford, someone portraying Betty Ford. They're always very good. I know this young lady myself, and she's really excellent. And a taste of some favorite food and some beverage that they liked. And you can go to Gilson House Museum, and you can sign up for that. I think we're pretty well
I just have
shot
one
there.
quick question. On
Yeah.
the Wyndham Inn, is it really haunted?
Oh, it is. Yes,
Oh,
it is. Oh,
all
yeah.
right. So,
Oh, yeah.
all right.
There's no
Nice.
doubt of- no, but
Everybody
I've been
should
there.
go to
I've been
that
there
event
almost 3/4 of a century. I know it's been haunted. We're done. Thanks, Matt.